Outside, internally, we have the renal cortex, which is outermost. Inside we have the renal medulla. Note the renal medulla is not a continuous medulla. It's composed of subunits called pyramids. Each of these is a renal pyramid. All of the renal pyramids are the renal medulla. We have intrusions of the cortex between pyramids, like this one here, or here. Those are renal columns. The tip of each pyramid is a renal papilla, and the urine emanates from there. It is collected by these funnel-shaped collectors called minor calyces. Each one of these is a minor calyx. There's a cutaway view of one there. Here's another there. Down in there, we're looking down in one, seeing a renal papilla down in there. The spaces between the minor calyces are your renal sinus, and actually they would be filled with fat. On this model, they're not, but in life they would be filled with fat. Okay. When two or more minor calyces unite, you have a major calyx. That's a major calyx there. Here's a major calyx. All the major calyces converge in the renal pelvis, which is in the hilum of the kidney, and it exits as the ureter, which will take the urine to the urinary bladder. Our vascular net here, the renal artery is bringing oxygenated blood with impurities in, branches into segmental arteries, which branch into interlobar arteries, which go through the renal columns, and then arc around the base of the pyramids as arcuate arteries. Coming out of those and going into the cortex are interlobular arteries. Okay. On this model, each of the little white dots is a renal corpuscle. There's one renal corpuscle per nephron. There's about 1 million nephrons in each kidney. Here we see 2 nephrons indicated, and not only the renal corpuscle, but the tubules and so forth. Coming out of the cortex, we have interlobular veins. They drain into the arcuate veins, which drain into the interlobar veins, which are alongside the interlobar arteries, which drain into segmental veins, which unite to form the renal vein, taking the deoxygenated but purified blood out of the kidney. Okay. So that is your kidney model.
Very good.